First of all, I have to ask you about the mask that's behind you. Do you mind just showing it to us and explaining why it is so important now?
So this is a rigid plastic mask. There is some movement in it for patients, and it does have cutout around the mouth. It is obviously designed that patients can see through it, they can breathe through it, but it does keep them very still. And so we deal with millimetre accuracy. If the patient is a millimetre different to the position the treatment was planned in, then the bed needs to move that millimetre. And we can't get that accuracy without some degree of immobilisation. So I know, Julie, you like to call this the safety mask, and that's what it really is. It's about protecting the areas that are really important, protecting the eyes and those salivary glands, but at the same time, making sure that we don't miss that tumour. And with old radiotherapy, where it wasn't as accurately delivered, there was a lot more give. You're much less likely to miss the tumour if the patient moved a bit. But the problem of that radiation therapy was that it caused a lot of dose to go to areas we didn't need, and a lot of the side effects that people will read about and hear about for patients that were treated, more than a decade ago with old techniques. This mask is made, it's heated up and pulled over the patient. We recognise it's really difficult for some patients, and we have to provide them lots of support. I certainly now never get a patient to agree to radiotherapy or talk to them about radiotherapy without showing them one of these things. And then there are some very useful videos, like on the Targeting Cancer website that you've done, Julie, to help educate patients so they aren't surprised when they turn up on day one what this is about.